Alterations in integument, skin, hair, and nail disorders. Dermatitis is an inflammation of the skin. There's two types that include allergic contact dermatitis in clients that are sensitive to one or more substances, and primary irritant dermatitis that occurs from a chemical exposure. It may include a localized or generalized rash. We're going to see dilation of blood vessels, itching or pruritus, and blistering. To manage this, we need to remove the substances that cause the irritation by flushing the skin with cool water, application of topical lotions, corticosteroids, or wet dressings. As a nurse, we encourage them to wear rubber gloves if they are in contact with chemicals. Encourage a second laundry rinse cycle and avoid the use of substances until it's determined if it is a causative agent. So true or false? There's many different etiologies for dermatitis. This is false because there's many different allergens that can result in dermatitis, but dermatitis itself is an allergic reaction to specific substances. So while there's might be a lot of irritants, the etiology of dermatitis would be the allergic reaction. Now, acne is a skin condition that commonly begins in adolescence and it can last into adulthood. It affects the sebaceous glands and the hair follicles, resulting in an overproduction of sebum. We may see an oily scalp or comedones and pustules, which are also known as pimples. We treat it by encouraging gentle facial cleansing, drying agents, topical or oral drugs, antibiotics. The dermatologist may remove them with instruments, might do some dermabrasion, which would remove surface layers of scarred skin. And as nurses, we should encourage the client to keep their skin and hair clean and avoid using oily products. Realize that specific foods do not cause acne. Rosacea is a chronic skin disorder characterized by a rosy appearance. The cause is unknown, but it may be caused by bacteria or mite infestations. It has an increased blood flow that can last hours or days and eventually will become chronic. It can develop unevenly thickened and distorted skin surfaces. We can also see intermittent blushing, papules, pustules, facial swelling, or rhinophyma, which is a permanent enlargement, reddening nodular surface of the nose itself. There's no cure, but treatment will involve minimizing symptoms and oral antibiotics, topical medications, maybe a pulsed light treatment to help improve appearance. We need to remind the client to help figure out what these triggers are and minimize skin exposure to the sun, in addition to performing basic skincare regimens. A furuncle is a boil, while multiple boils is furunculosis. And a carbuncle are going to be boils in which pus is draining from it. Pathophysiology and etiology, these are caused by skin infections. They're also associated with diabetes mellitus. We may see painful pustules that are surrounded by erythema, fever. The client may have anorexia, weakness, or malaise. We would treat it with hot, wet soaks, antibiotics, surgical incision, and drainage. We need to encourage the client to use a strict aseptic technique. They should never pick or squeeze the sites. They need to wash any cloth that's used around the site separately and use bleach to kill any bacteria that may be on the cloth. So true or false? Furuncles, furunculosis, and carbuncles are treated with antibiotic therapy. This is true. Remember, they are the result of skin infections or diabetes mellitus. A culture and sensitivity is going to help figure out what the appropriate antibiotic to use is. Cellulitis is a common bacterial skin infection that causes redness, swelling, and pain in the infected area of the skin. The bacteria gets into the body through various openings in the skin, whether it's a wound or other area. We're going to see red, swollen skin that's painful and warm to the touch. It may look pitted like the peel of an orange, or we may see blisters. The client may also experience fever and chills. We're going to treat it with antibiotics. And then we need to make sure that we keep the wounds clean and use good hand hygiene. Psoriasis is a chronic non-infectious inflammatory disease in which there is an excessive proliferation of skin cells. Plaque psoriasis would be the most common type. The cause is unknown, but it's likely a genetic predisposition, and it also requires a triggering mechanism, and it may have some immunity component. Some people will have systemic effects of this disease, such as psoriatic arthritis. We will see erythema with silvery scales and lesions on the skin of these clients. There is no cure, but symptomatic treatment would be done. We can use drug therapy, biologic therapy, and photochemotherapy. Scabies is caused by infestations with tiny itch mites. They're spread by skin-to-skin contact, but it does not involve poor hygiene. The mite will burrow into the upper layers of the skin where it lives and lays its eggs. The client will experience itching and maybe some excoriation. We need to treat it with scabicide application. The client should bathe thoroughly and clean their clothing while avoiding contact with those that are infected. We need to advise our clients not to itch and that this itching can continue for 2 to 3 weeks post-treatment. Pediculosis is going to be an infestation with lice. It's transmitted through direct contact or the sharing of personal items such as combs, brushes, or clothing. The client will have itching of the scalp. They'll have brown crawling insects the size of sesame seeds, or small yellowish white ovals, which are the nits, that are attached to hair shafts. You can also see small gray nymphs or silvery eggs attached to the hair shaft. We will manage it with pediculicides or mechanical removal of the lice. It's thought that lice may be developing strains that are resistant to chemical extermination. So that mechanical removal is going to be extremely important. We need to make sure our clients are educated on how to detect lice, that they should not use hair conditioner prior to the application of the pediculicide. All people in the home should be inspected and clothing should be washed along with bedding, and furniture needs to be vacuumed along with vacuuming of the carpets. Dermatophytosis are superficial parasitic fungal infections known as tinea, and more commonly known as ringworm and athlete's foot. This fungus can invade the skin, scalp, and nails. We might see rings of papules or vesicles with a clear center. The client will experience pruritus or sore skin. We treat it with oral and topical antifungal agents. These clients should be recommended to use separate towels, washcloths, grooming articles, and clothing. They need to dry thoroughly after bathing. They need to avoid tight-fitting clothing, and they should wear footwear in community showers. Herpes zoster is more commonly called shingles, and it's caused by the varicella zoster virus. This also causes chickenpox, and that lies dormant in the body for years. So herpes zoster comes around because of reactivation of the varicella zoster virus. Symptoms will occur in one or more cranial spinal nerve routes and can cause eye ulcerations, vertigo, and permanent hearing loss and stroke. We're going to see raised, fluid-filled, and painful skin lesions that look exactly like chickenpox because it's caused by the same virus. There's going to be inflammation in the dermatome. This is the skin that's supplied by the nerve. There's going to be itching or post-herpetic neuralgia, otherwise known as pain, that can persist for months to years. We're going to treat it with antiviral medications that should be taken within 48 hours of the first symptoms because this will lessen the severity or prevent additional lesions. We also treat it symptomatically, and we also encourage vaccinations prior to coming down with herpes zoster. We should discourage contact with people that have not had chickenpox. We can encourage cool or warm compresses, whichever feels the best, and the wearing of loose clothing would be very comfortable. There's 3 types of skin cancer. Squamous cell is going to be flat and scaly. Basal cell will be more round. And melanoma, which contains color variations. Now, melanoma develops because of an increased exposure to ultraviolet radiation, and fair skin will also increase that risk. We will see new appearance of growth or changes in the skin color with melanoma. We treat it by electrico-desiccation, surgical excision, cryosurgery, and radiation therapy. Nursing management is going to follow the ABCDEs for melanoma identification. We look for asymmetry, border irregularity, color that is not uniform, a diameter that is greater than a pencil eraser, and evolving change in the lesion. We encourage these clients to use sunscreens and lip balms with sunscreen. They should wear a hat with a wide brim. They need to stay in the shade, avoid artificial tanning, avoid prolonged sun exposure between 10 o'clock in the morning and 4 o'clock in the afternoon. Actinic keratoses are precancerous lesions that are generally found on the face, neck, forearms, and the backs of hands that are frequently exposed to sunlight. They can become malignant if they're not treated, and they're more common among older white adults. They appear as papules or plaques of irregular shape. The hard scale on the lesion might shed and reappear. Treatments would include drug therapy, cryotherapy, surgical excision, or electrico-desiccation. Tattooing is the pigmenting of the dermal layer of skin with needles, and it contains dye. Selected certified tattooist let me just start over again. You should select a certified tattooist although certification is not required to apply tattoos. Inks are not FDA approved for injection into the skin. Tattooing risks include allergic reactions, blood-borne infections, granuloma, which is an inflammatory nodule lesion, keloids, which is an overgrowth of scar tissue. And you need to understand that inks may also be carcinogenic. Skincare following a tattoo includes prevention of infection, supporting tissue regeneration, protecting the skin from further trauma, and understand that tattoos may cause complications with an MRI. With tattoo removal, this can be done with laser treatment, dermabrasion, Sala abrasion, which uses a salt solution to abrade the skin, scarification, which uses acid solutions, plastic surgery, but you need to realize that the skin will never return to normal. So the option of using a polymer dye that can be removed with the use of a laser is there if you're not sure you want to keep this tattoo, or even using a temporary ink. So, true or false? All tattoos must be created by a certified tattooist. This is false. Tattoos can be applied by anyone. The only regulation for tattoos is by local jurisdictions. Body piercing is going to be the insertion of a piece of metal into a body part, with the lips, ear cartilage, cheeks, nose, tongue, eyebrows, navel, etc. being some of the more common locations. After body piercing, oral and/or personal hygiene has to be observed. The jewelry has to be moved during cleaning. The client should avoid public pools or bathing areas, avoid using cosmetics in that area, avoid skin drying agents, and they should wear loose clothing. To remove the body piercing jewelry, sometimes, depending on the placement, it may be necessary when antibiotics are ineffective against infection, and some of those may require a special jeweler's tool. Seborrhea and dandruff are non-inflammatory conditions that sometimes are accompanied by seborrheic dermatitis, which has an inflammatory component. Seborrhea is caused by excessive secretions from the sebaceous glands. The scalp is the primary site, and dandruff may be caused by a fungus. We may see oily hair, red or scaly patches on the scalp, or white flakes from the hair, and itching. Frequent shampooing with or without medicated shampoos and/or corticosteroids may be the recommended treatment. We should advise the client of the shampooing need and the potential for this condition to recur. Alopecia is a condition in which some or all of the hair is going to be lost, resulting in partial or total baldness. It may be caused by medications, an inadequate diet, tinea infections, or thyroid disease. And alopecia areata is an autoimmune disease, while androgenetic alopecia is going to be what we call that male pattern baldness. We're going to see thinning hair that's not associated with any physical disorders. We treat the underlying medical disorder. We may use drug therapy, hair replacement surgery, hair grafting, scalp reduction, or a skin flap transfer. We need to provide emotional support, recommend the use of conditioner, and the change of a hairstyle to help prevent pulling on the hair. Nails are subject to disorders, and they include fungal infections or ingrown toenails. Fungal infections can easily spread from one nail to another, usually around the toenails. We might see elevated, thick, distorted, loose, yellow, friable nails. We're going to treat it with a prolonged systemic drug therapy, potentially nail removal or surgery. We encourage compliance with drug therapy. We also encourage the client to alternate shoes daily and never to go barefoot. And they should always wear footwear at public pools and showers. Ingrown toenails usually will occur on the inside edge of the great toe. They can be caused from an inherited trait, may be caused by fungal nail infections or improper shoe fitting or trimming of the nails. We will see swelling, redness, pain, maybe some purulent drainage or odor. We treat the infection. We may encourage soaks with warm water or Epsom salts. We may need to lift the edge of that nail, maybe even putting a little piece of cotton under there to keep it lifted, or surgery to remove that edge of the nail. Again, we encourage the foot soaks, relieving pressure around the nail. And if the client has diabetes, vision problems, or vascular problems, they should be encouraged to see a podiatrist.